Okay, very good morning. Okay, we'll just quickly go through the remedy that we had discussed in the last class. So the remedy we spoke was Erigeron. And Erigeron, though we had prepared a PPT because of power issues, we just managed with the blackboard. So what we'll be quickly doing is, I'll quickly run through the PPT so that it will be a revision for you. Okay. And of course, we'll continue with a new remedy after 10-15 minutes. So what was Erigeron all about? Yeah, it's a hemorrhagic remedy. Okay, so there is also an indication of Erigeron during dentition. So what happens in Erigeron during dentition? There will be dysuria. Good. So I'll quickly run through what I had planned and then we will come back. Okay. Yeah, no issues. So we'll quickly run through what we had planned. So I was just trying to tell you that teaching of materia medica will change in different years. Okay. Though you have materia medica for 4 years, how you understand how a teacher teaches materia medica will vary. Okay. So this is what I was just trying to tell you. As we evolve as a homeopathic student, learning materia medica also will change. Okay. So this we had some discussion and we also had some inputs from you. As a final year student, how exactly you expect me to teach material? Because this is my first class for you as a final year student. So what we realized is, we look into group characters and then we also concluded in the last class, we need to integrate or we need to use the knowledge of medicine, OBG, surgery, using the knowledge of repertory. Okay, this itself is a different learning process. Must be we can take a remedy. With an example, I'll show you how materia medica can be learned through repertory. And we also saw that through miasms, which is a very integral part of a remedy, you can study materia medica. So knowledge of organon also becomes very important. And then we saw this anaphysio, toxicology, pathology. Yeah, we concluded that integrating all this will make materia medica learning more fruitful. Okay. So going ahead, so clarity and better understanding of the remedies will happen when you study materia medica keeping these factors in mind. Okay. So going ahead, what we also saw was, I told you next few months, must be 6 months, 7 months, you will become licensed doctors. So our focus should be on clinicals, meaning a remedy when it is taught, expectation is we need to bring in more cases so that you get an idea how the theoretical knowledge can be applied into practice. Now this is very vital, and of course this was what I was trying to tell you. Materia medica becomes very important for your therapeutics. So understanding materia medica in those lines also is very, very important. And the last thing was emphasis to be given on comparisons. Make sure remedies are compared. If you study remedies through comparison, you'll get more clarity. So this is what I was trying to tell you, and more of cases. Okay, and this is what I was trying to explain in the last class. The subject should be understood with a vision to apply the knowledge of the same to become a better homeopath. You need to have a vision. Otherwise, reading materia medica for theory, for passing, will not, bring in any josh. And if you are clear that this is a subject, the knowledge of which helps you in practice in the future, probably you will understand or you will remember materia in a better way. This is what I wanted to emphasize. And we started with Erigeron. Though we use blackboard, I personally feel you have a picture of Erigeron, but images will have a better impact.
So must be 7-8 minutes. Quickly I'll run through the PPT, and then we will continue with the new remedy. Okay. So I was asking you the same question last time. The hemorrhagic remedies. I know you have done a great job in recalling the hemorrhagic remedies. We'll not go back there. We'll start with Erigeron. So Erigeron, this is the plant taken from Google. Okay. Erigeron canadensis. And I told you it belongs to Concomitant. Just a quick recall of what we have done. And two common names, horseweed, butterweed. And tincture of the entire plant is what we use. This piece of information for a final year may not be very useful, but just keep it. We'll see. This is very important. So what is it that we understood in sphere of action? Cardiac plexus. Very good. I'm happy you remember. Cardiac plexus. So Erigeron has an affinity for the cardiac plexus. And what exactly it does? Acting on the cardiac plexus, it will cause constriction of the blood, muscle wall of the blood vessel, and muscle wall of the artery, and in turn it gives rise to constriction followed by bleeding. So this is a slide which tells you all about Erigeron. Why there is bleeding in Erigeron, what is the pathophysiology of Erigeron is what you understand here. Okay? Done? I hope this is clear. And we were also trying to understand that it has main action on the uterus, and we also saw that it acts on the kidneys, and the last thing we also saw was that J. And acting on all these areas, predominantly Erigeron causes bleeding. Anyway, we will discuss this a little later. And this is what one of your friends was showing. Complaints during dentition. In the last class, you have given me a lot of remedies, starting from Sina, magnesium phos, Mactar, a lot of remedies. Fine. So, other remedies during dentition. And focus is on hemorrhages. Hemorrhages, which comes from nose. See, simple way of understanding. A sure shot question for you in your exams. What is that question that can come up? Describe the hemorrhages of Erigeron. 5 mark question. Okay? Fine? See, if you understand Erigeron through a method, it will become very easy. So first thing what you need to understand is, from where all you have hemorrhages in Erigeron. First point. Second point is, what is the color? Good. What is the character? If you understand this much now, things will become very easy. So from the last class, what we have done, nose of Erigeron, what do you have? Very good. Epistaxis during fever, pregnancy. Very good. Epistaxis during fever and during pregnancy. Important. Okay. So this is what I have told. See, and I also told you, this is the only remedy in which you have epistaxis throughout the pregnancy. I gave you 2 more remedies. Sepia and thalapsy. Very good. Sepia and thalapsy. That is epistaxis during pregnancy. It can be any part, any period. But the whole of pregnancy, single remedy is Erigeron. Okay. And we also saw that hemorrhages can happen from the J, from the stomach. Hematemesis, yes, good. From the ulcers. Bleeding from the gastric ulcers, good, possible. So a lot of things we saw here are mentioned in red. Vomiting, blood, motion aggravation. Hematemesis due to ulceration of the stomach. Hemorrhoids with bladder complaint, single remedy, Erigeron. And we also saw bleeding with hard, lumpy stools, burning in margins of anus as if it is stone, the rectal affections. Okay, and very important was the female, the uterus. Yes, very good. The hemorrhage or the bleeding which keeps gushing hemorrhages. Okay, and we also have hemorrhages from kidneys. Sorry for the color, I thought red will depict blood, but unfortunately it's not very clear. Bright red gushing from any orifice from slightest motion. Weakness from a little hemorrhage. Okay. See,
this is important, we skipped this point in the last class. Now what is important in this statement? What do you understand from this? Yeah, very good. Yeah, very good, correct. The word is important, don't worry. See, weakness is not proportionate to the hemorrhage. You agree? For example, small hemorrhage, a thorn pick, 2-3 drops of blood. Do you feel weak? When will you feel weak? When you are Erigeron patient. Okay, so Erigeron patient will feel weak even from a slightest or from a minimal bleeding. They can feel weakness. Weakness out of proportion to the bleeding, very characteristic. Single remedy, so you need to remember. We were talking about, can I have some quick inputs?
Weakness of the
uterus. Yeah. Atony, good. Slightest exertion causes bleeding. BPH, APH, dysuria. Dysuria during labor, single remedy. During pregnancy, during labor, during dentition, we are talking about female. No problem. Hemorrhage comes in gushes. Okay, then okay, lokia, which can be bloody. Abortions which mainly comes from weakness, atony of the uterine muscles.
Last class I told a remedy wrong. Fraxinus americana. Must be I would have pronounced it in a different way. Kindly correct it. The remedy is Fraxinus americana. So when you have abortions, hemorrhages from uterine atony, metalurgia after abortions, menses, you have all those characteristic things like gushing, little hemorrhage can bring in weakness. Okay. Postpartum hemorrhages, lokia, pregnancy, bleeding during 6th month, very characteristic. Bleeding during 6th month. The only other remedy mentioned is cannabis indica. Overexertion. Okay. So these are few things related to uterus, and then we saw kidneys. Persistent hemorrhage from the bladder, dysuria, during labor, during menses, in teething children. Only remedy is Erigeron. Painful child cries while urinating, profuse strong urine. One last statement. I don't know if I mentioned it in the last class. What is this? Ecchymosis after injury. Okay, it was told. Ecchymosis from blow injuries. In the eye chapter, it is mentioned in a repertoire. Single remedy. Erigeron. Okay. Modalities, left side, rainy weather, exertion. Okay. Yeah, see, this is what I wanted to tell you. Michele, repens, bright red bleeding associated with dysuria, but it is continuous. And how was it in Erigeron? It used to come, it used to go. But in Michele or Michela, it is continuous. And we were talking about this associated with dysuria, with menses. Bleeding is not profuse like Erigeron. Okay? And we also have one more remedy here, and this is Bovista. Hemorrhage from engorged uterus when flow is between the menses, little aggravation, little exertion, flow at night. And we are talking of this. What was this? What is this remedy? Ustila. Okay. Hemorrhage during labor, abortion, menopause, bright red, partly clotted and fluid. And bleeding on digital examination. This was discussed, I suppose. We were talking about CA cervix on PP. Okay. On parvaginal examination, the lady can bleed. Uterus is spongy. Uterus is in a very delicate stage. If it is not cancer, you can think of Ustila. If it is cancer, then you learn to think of better remedies. Okay. So we were talking about the clinical utility. I feel we have done justice to this part. Okay. So I have been a little fast so that we can focus on a new remedy. So if Erigeron is clear, we'll start off with a very small remedy, simple remedy. So a remedy and this as a final year student, the image that I am going to show you, you would have realized that the remedy I am going to discuss is a remedy which is indicated for cough. Yeah, I mean there's a demo. So what is that cough that you saw? Single, very good, beautiful. Single paroxysm, good, welcome to it. I have a beautiful case to share. I'll share it with you. Thank you for copying, whoever it is. It makes sense because I did not have calcarea in my mind. Thank you. And I had a case just yesterday evening. We had prescribed calcarea to a boy. I'll be sharing that case as well. Now, my question to you was, what remedies, as a final year student, what remedies come to your mind when you talk of cough? Very good. And there was a huge noise, I don't know what you told, but okay, good. So it continues. Very good. Good, keep it up. Anti-pad, good. See, I'm blessed to have good students also. Many times they tell, blessed to have a good teacher. It's equally important to have good students. Otherwise, whom do we teach? That's important. So the noise that you're making, in giving answers, the loud noise makes a lot of sense. So pulsatilla, drosera, spongia, calcarea, okay, Brevenia, fine, natrum self, cuprum, phosphorus, dulcamera, simple, good, spongia, stannum, very good. I mean there are a lot of remedies. And mug, yes, there are a lot of remedies. So we'll see as and when time permits, we'll take up those remedies so that we can have a small comparison. To start with, we are talking of a remedy mainly indicated for cough and two small cases. Now this is a case of a boy who had cough and the mother or the parents, they had consulted an allopath and they had also tried some other system of medicine. Unfortunately, the cough did not reduce. That's when they came to me. And this is the scenario generally. They try a lot of other systems and then they come to us. So the same thing happened with this boy. Parents tried a lot of other medications and then they came. Now when you have a case of cough, okay, now what is important? How do you make a totality? Or what are the points you consider in prescribing a remedy? Simple question. One second. See, 1 second. Very rarely teacher makes a request one at a time, please. Otherwise, we have to keep asking. You tell, I'm happy, a lot of enthusiasm, a lot of right things, but preferably one at a time so that we get a clarity. Okay? So boys, cough. What is it that we look at?
Productive or not?
Very good. I was looking there suddenly. Good. So first thing you see is if the cough is dry, good, or if the cough is productive, good. Anything else you can think of? Dry. Wet to dry, good. Good. Wet or dry. Anything else? Duration. Since how long? Is it from yesterday, day before, or is it from few months, few days? Good, it makes sense. Now why it makes sense? Whether the cough is of a recent origin or whether the cough is of a long duration. Why does that question make sense? Okay, for as a medicine student, you might be looking at a diagnosis. As a homeopathic student, your approach, is it an acute approach or is it a chronic approach? Fine? Cough of long duration. We don't think of acute remedies. We think of a chronic remedy. Good, very good. Duration, productive, or dry. Makes sense. Good. Type, good. Modality, paroxysm, character of cough, ailments from, character of expectoration, any exciting factor, any associated factor. Yes, concomitant, good. Is having any other pain, any other discomfort, breathing difficulty, etc., etc.
Examination findings.
Examination finding, yes, good. Good, it makes sense. Examination finding. Okay. We had a case of a girl, very young girl with a bad pain in her knee. And she would not allow me to touch. Our assistant doctor, tried, the girl tried to touch. I also tried to touch. Uncle, no, you're not touching. It pains. Immediately father told a statement. Sir, even me, she will not allow me to touch. But she needs massage. You getting this point? See, simple. And how easy it is to solve a case. What is the case? She's got bad pains. To be very honest, initially, when this case came to me, she had pain in the shoulder and this came down and pain was here, pain came to knee. So what is this? Very good, hearing span. So 15 days I also was relaxed. I thought next it will go to the ankle and then it will go to Mother Earth. It will go down. But unfortunately after 15 days she was not fine. Pains are more, knee pain is still there. Not allowing to touch, she stopped going to school. All these things. But what did father tell? Every night before she sleeps, sir, I have to massage. Somebody was talking of observation, somebody was talking of examination. That's why I got this case here. So he has to literally press her knee. Only then she is better. Now what is this? Pressure analyzation, very good. Can somebody think of something else? What is this? She is not allowing you to touch, but she is better by pressure. Okay, very good. One of your friends says hysteria. Beautiful. I'm happy. Answer from a final year student. Only hysteria. Second thing, she can be acting, no? Nothing करेगी. मेरे को स्कूल नहीं जाना है. That possible. Okay. It was not hysteria. It was not malingering because her anti-CCP was high. अर्थ लगता है क्या? This is how you decipher. This is how you differentiate. If it was acting, her blood report should have been normal. If it was hysteria, her blood report should have been normal. Her anti-CCP is high. So this is not acting. This is not hysteria. This is a genuine case. Now what is this? Simple. One remedy. I have done it to you, unfortunately. I feel more bad because I have done it to you. Who is that? Why ignition? Very good. You're getting my point? You know why I'm feeling more bad, more sad? When I told you this case, I thought there will be a volcano. Everybody will shout ignition. Okay? Now why you did not shout ignition? Because you need to understand the process. This is contradictory. And if you go back to my ignition class, I have given you similar examples. Then go back, see the notes, I have given you examples. Many of your friends are nodding their head now. So this is how you identify in your clinic. And trust me, ignition one dose. 15 days next she comes, absolutely fine movements. And I can touch, no issues, no pain uncle, I am absolutely fine. This is what a simple observation made the difference. It's a contradictory symptom. Touch aggravates, pressure aggravates is contradictory. Remedy was ignition. Okay. We'll come back. I was sharing you this case, small case of cough. In a very young boy, 7 years, 8 years. And what I heard him coughing is, he coughs for a short period. And then there is no cough. Again, after 15 minutes, 8-10 coughs, no cough. 8-10 coughs, no cough. No cough. When he entered my chamber, one more beautiful observation was, while coughing, first time in my life, 25 years of practice, first time in my life I have seen a boy coughing and doing this. Okay? And I repertorized. I'll tell you what rubrics I have taken as a final year student. And that remedy I never used in my 25 years of practice. I did not have that remedy, and next time we purchased that remedy and it was given to this boy, and within 2-3 days cough vanished. Okay? One case. And second case, with due respect to one of our student who also had a cough, which was again a similar type of a cough. Please concentrate on this point. Even in first case what we saw, Cough was not a continuous cough. Cough was for a short period. Again, no cough. Again, short interval, and there's no cough. Now this we also had in one of our students, for whom we had given the same remedy because she had the same character of cough. Though in this student, I did not prescribe the remedy on the first instance. I had given her bryonia, I had given her sepia, 2-3 remedies I had given. Unfortunately, those 2-3 remedies did not work. And she promptly came back to me without any relief, and then we prescribed a remedy, and that remedy is what we are going to discuss in detail. And this is the remedy that we are going to discuss today, and this remedy is what we call it as Squilla maritima. So before I started the remedy, you already know a little information about Squilla, and what is that information you have got? It is a remedy which mainly acts on respiratory tract, first point. And acting on the respiratory tract, it causes cough. And cough which is of short duration. See, there is a rubric, cough paroxysmal short. Cough coming at an interval and at a very short interval. And the cough is also very short. Not like 1, 2, 3, 4. You have it in your repertory. Cough single, cough 2, cough 3, cough 4. This is not that 1, 2, 3, 4, but 7, 8. You don't have 7, 8. Okay. If cough goes beyond 5, you don't have it in a repertory. Don't get tensed. If it is not continuous, if it is only 7, 8 coughs, then you have this rubric. Cough paroxysmal short. You please take that rubric. It has some 12 remedies. And one beautiful remedy is Squilla. Okay. So 2 cases. My experience though is very limited with Squilla. I have about 2 cases that I can share it with you, where I have indicated Squilla for cough with beautiful results. Okay. So Squilla, the common name is sea onion, tincture of the fresh bulb, and from the books, from the source books, it grows on the shores of the Mediterranean Sea and has a place in the medicine from the most ancient times. Meaning, before it was introduced into homeopathy, Squilla had medicinal utility, or it was used as a medicine. And what was it used for? See, again there, you can see cough, heart complaints, urinary and alimentary ailments, meaning gastric, alimentary canal. Okay. So this was what is already known to us about Squilla. Then somebody in homeopathy, they prove and they realize this remedy has some action on the kidneys, it has some action on the GI in general and spleen in specific. Okay? And it has action on the heart. But more important, it's a respiratory remedy. More important, it is a respiratory remedy. Like Erigeron, we discussed, it is mainly a hemorrhagic remedy. So Squilla, you have to remember the respiratory tract. Very important. Very important. Clear? Okay. So one final question that you can expect in your exams is describe the respiratory affections of Squilla. Or you are a final year student, they might ask you to compare with few remedies. Okay, we'll look at the comparison a little later. So first thing is this pair of action, kidneys, spleen, heart and respiratory. And respiratory, if you see, I have mentioned the entire respiratory tract. What do you mean when I say the entire respiratory tract? You have the upper and the lower. So Squilla is one of those few remedies which has an affinity both for the upper and lower respiratory tract. Any other remedies which can affect upper and lower respiratory tract? Very good. Who was that? Yeah, brain. Okay, good. Sorry. I plugged this. No, this one remedy, carbo animalis. What is the specialty of carbo animalis? Confusion where the noise comes. So the girl is telling brain here and I am looking somewhere else. Okay, I am not carbo animalis. The problem is with the mic. I have plugged my ears. Right? So brain, very good. Good thought. Brain. Simple remedy. Ailments
Ailments. You saw Ailments having cold, and Ailments also has a little amount of lower respiratory tract affections. Though predominantly upper. Arsenic, good. Arsenic is arsenicum, arum drapellum. Okay? Arsenicum iodatum, natum sulf, pulsatilla. You can also add squilla. Okay? So, in today's class, we'll be exclusively focusing on the respiratory tract. For a UG student. Must be once you come to PG, we can look at the kidneys, the spleen, the heart. Though I will be giving you a small information. In detail, you can elaborately discuss in the PG class. For the final year UG class, focus will be on the respiratory tract. Okay? See, I was looking into the ailments. Causation. You have one book, Clark's Causation. I don't know if you have observed or if you have seen this book. It's a small book available in the library. So there in Clark's Causation, book on causation, Clark says, what do you see here? Bloodletting. Ailments from bloodletting. Okay? Done? Only two remedies are mentioned in our Materia Medica. One is Squilla and the other one is Senecio, which we also discussed in Erigeron. It's a hemorrhagic remedy. It's a female predominant remedy. So Senecio and Squilla are two remedies which are ailments from bloodletting. And one author says pleurisy and pneumonia which comes after bloodletting. So bloodletting, I doubt if we practice, though it is practiced in some systems like Ayurveda and Unani, I'm not very sure. So somebody after bloodletting, they come with lung affections. The only remedy we have in homeopathy is Squilla. Okay. Fine. And I'm not sure what happens in Senecio, but in Squilla it is mainly the respiratory affections. Next 20 minutes or 15 minutes we'll be focusing on respiratory tract. Okay? All fine? Okay. So respiratory, I told you can write the first line there that it is a remedy which affects both the upper and the lower respiratory tract. First line. Okay. And then what you have to understand is, now can I have some inputs from you? When I say upper respiratory tract, what could be the probable symptoms? Very good. Coryza. Sneezing. Good, no issues. Pharyngitis, okay, good. See, okay, we'll not go into tonsils, but what you need to understand is, we are looking at the nose, okay? And nose, you can have coryza, you can have sneezing, you can have polyp, you can have DNS, etc. Okay, but here in this remedy, you'll have two very important things. One is coryza and the other very important thing is sneezing. Okay? And we'll try to understand what is the character of sneezing you have in this remedy. Squilla. Okay? Any other remedies for sneezing? Sabadilum. Very good, Sabadilum. Beautiful remedy. Onosmodium. Sneezing. Ailments. Arsenic, iodatum, pulsatilla, brevenia, a lot of remedies. Okay. So, sneezing, the character of sneezing in Squilla is very important. The character of sneezing. See now why this becomes important is, tomorrow in your clinic, if you want to prescribe Squilla, we can't prescribe Squilla only on the basis of sneezing. Okay? We need to know more details. When is the sneezing more? All those questions will come up. So the character of sneezing in Squilla, first point is it is violent sneezing. We have many advertisements coming on TV. Somebody is sneezing, and some other person is coming and asking. I don't know if that ad still exists on the TV. Non-stop sneezing, right? Okay, so violent sneezing, violent constant sneezing. Sneezing with coughing. This is very, very characteristic. What is this?
They're sneezing and they're coughing also. It's little difficult, don't ask me to do a demo, because sneezing and coughing. But if you are a good homeopath and if this is happening in front of you, they're sneezing and they're also coughing. Like I told you, I saw this boy rubbing his face when he was coughing. And that was my entry point for SQUILLA. Trust me, beautiful results. And parents were very happy. They also gave a video of what happened after taking homeopathy. How many months my son was suffering, and after taking homeopathy, how beautifully cough reduced. Fine. So, SQUILLA and that observation, sneezing with coughing. You have this combination, you can think of SQUILLA. See, another very strong symptom. Can you see the symptom here? Can you correlate how violent the sneezing is? That, see, we have heard of this situation. Fine? I mean, many times we have women come into our clinics. Sir, I got a very embarrassing problem. I don't mean sneezing, sir. It's fine, it's okay. But you know what? Whenever I sneeze, the urine escapes. That's very embarrassing. Okay? Done? So, such situations, we have come across. But look at the seriousness of SQUILLA. Involuntary stools while sneezing. Okay? You have a lot of other remedies. You have phosphorus, you have murk, aloes. Okay? Done? So you have a list of remedies. Involuntary stools. See, in aloes it need not be sneezing also. If you have read Kent's, if you have read aloes in Kent's, what he says is, a boy will be going and without his knowledge, pebble of ball-like stools are being passed. Involuntary stools. Okay? So, violent sneezing, and this is very important for you. And the second part in SQUILLA is coryza. Coryza, discharge from the nose. And that's again something very characteristic. And SQUILLA does not produce polyp. And SQUILLA is not a remedy for DNS. These are the two possible things in SQUILLA under upper respiratory tract. Okay? So coryza, what remedies for coryza? What remedies for coryza? Arsayod, Natum self, pulsatilla, a lot of remedies. Now, what is important? It is like Ailments, it is like arum triphenol, it is like arsenicum iodatum, or it is like nitric acid. So, what is that common thing you have in all these remedies? The discharges will be acrid. So, coryza, which is acrid. Coryza, which is acrid. Acrid coryza, profuse coryza, margins of the nostrils feel sore. Many times we have patients coming with red nostrils. With cold coryza, so much of sneezing, irritation, it's burning, acrid. Okay? So this can be a situation. In which remedy it is so acrid it eats off the mush? Okay, borax. What is acrid in borax? Leucoria. I'm talking about upper lip. Ailments, good. Ailments, creosote, arsenic iode. Arsenic iode. Don't forget. Iodine. They will have very acrid discharges. Discharges which will eat off. Iodine perspiration eats off the inner garments. You will see holes. Not that he has made. The sweating has eaten off. Iodine. Ars iode. The upper lip, the hair can be eaten off. Arsenicum iodatum. Okay? So we will continue with the lower respiratory. Now before I go to the lower, I hope the upper respiratory tract is clear. Focusing on two areas. Margins of the nostrils feel sore. Margins of the nostrils feel sore because of the acrid nasal discharges. Okay? Done? So now we'll talk of cough. Cough, one of your friends, when we said cough, he or she was generous enough to give a demo, and she is also generous. Now what was the difference between
this cough. The cough that your friend gave us a demo was a single cough. And I mentioned you in my previous class, single cough. The remedy is Calcarea. I had a case yesterday, a follow-up case of a boy who had bad adenoids, and again his specialty of cough is okay. At least in that Salman Khan's movie, I don't know, it was during our times, Madhuri and Salman's movie, it was Hum aapke kaun. So when Madhuri or when Salman they wanted to communicate, so they had a signal. Cough of two paroxysms. Yes, he did better than me. Right? So cough of two paroxysms. Now here in Calcarea you have cough, single cough. So I mean, see, these are something very, very unique to homeopathy. With due respects, for an allopathy, if it is single, double, triple, it will not make a difference. With due respects, we have got nothing against allopathy. But what you have to understand is, these are the things that we need to look for. When somebody comes to you with cough, don't jump to remedies. Ask character, when is it more? What happens before you cough? There is a remedy, it will have tickling at the throat pit. Sir, I have bad itching and then I have to cough. What is that remedy? Okay, there are many remedies. But one remedy I want you to remember. Some 21 remedies are there in your repertory. One remedy I have clinically experienced is Rumex. Somebody will talk to you about Rumex. Rumex has this tickling sensation in the throat pit. Coughing, cold air exposure or lying down, they all aggravate. Rumex, don't forget Rumex. Calcarea, single paroxysm. Right? Ailments, when he is coughing, he is holding his throat. Okay? So these are few things. Bryonia, holds his chest. Okay? So, cough in SQUILLA, we'll go in a very systematic order. What brings on cough? Cold drinks. Other remedies which is, better aggravation. Heparin, arsenic. Okay? Cold drinks bringing on cough. Cough better by drinking cold? Causticum. See, phosphorus is in general, it might be there, I don't deny. But specific cough better by drinking cold. Two remedies should come to your mind. Causticum and cuprum. There are many remedies. Even frost might be there, I don't deny. In frost it is a general ameliorating factor. Anything is better by cold. Phosphorus. I am talking to you about cough, cuprum, causticum. Okay? Exertion, change of weather from warm to cold. Change of weather from warm to cold. Any other remedies? What will happen in Bryonia? Cold to warm. One second, we'll clarify. See, it's important. In Bryonia, for example, Bangalore, it is November, December, Jan, Bangalore will be cold. And Feb, March onwards it will become hot. When the weather suddenly becomes hot, you see a lot of viral infections coming. They come to us with fever and all those things. Right? Okay? Done? Okay? So that will be Bryonia. That will be a Bryonia season. Right? So here, from warm, then again, April, May, and then it starts raining or it starts becoming cold. That's when you can think of SQUILLA. That's when you can think of Dulcamara. Right? Warm to cold. Okay? So this clarity you need to have. Then, now, these are the causative factors, and before cough, in Rumex, what did I tell you? Tickling in the throat pit. And in SQUILLA, tickling can be in the chest, lower down. And one author says tickling can be even in the spleen area. Here he feels irritation and then he will have a cough. Very unusual, very rare, that's why you should remember. If you are lucky tomorrow, sir, there are people who come with PQRS and you will be surprised how nicely our stalwarts have mentioned in our Materia Medica. Right? Okay? Dr. Kent also talks high about SQUILLA in his lecture. So, irritation in the chest, tickling in the chest bringing on cough. Okay? Or taking deep breath can bring on cough. Taking deep breath. These are two causative factors. The next thing is we are looking at the character of cough. How is the cough? Cough which is violent, dry, furious, exhausting, short. I have not used SQUILLA in furious, exhausting cough, but short paroxysms. Must be this short paroxysm itself is enough to exhaust them. Cough, short paroxysms. Remember. Okay? Cough provoked by taking deep breath, it's already there. What are the other conditions? Like it can be bronchitis, it can be bronchopneumonia. Bronchitis of old people with mucus rails, dyspnea, scanty urine. What is the better remedy that comes to mind? Very good, correct. Somebody. Very good. Antimonium tataricum. Bronchopneumonia of old. Chest is filled with sputum. He or she is not able to bring out phlegm because the lungs are in a very bad state. Antimtat is a better remedy than SQUILLA. Okay? Expectoration difficult in small round balls, sweetish taste, white and offensive. Generally in SQUILLA you have more of a dry cough. Very rarely it can be productive. Or to bring in that phlegm, no, they have to strain. They have to cough, and in the end a little amount might come. SQUILLA. Okay? So this is the cough per se in SQUILLA. And the next slide is more interesting if you are done. Okay. Yeah, no problem. You can make a note. See, it's all there in the source books. But I have referred few books and I am giving you in a nutshell. But that should not stop you from referring good books. Okay? And don't rely only on this. But you should cultivate the habit of referring source books. Okay? I'll go to the next slide. Okay, done. So what is important for you is with cough. See, what we are doing is we are going in an order. We started with ailments. We started with what triggers. We spoke of the character. We spoke of the condition. And now we are looking at with cough, what else can happen? Somebody was using the word associated, concomitant, all those things. So with cough, what else can happen? I told you cough is violent, and when they are coughing, they will have pain in abdomen. Or they can have pain in the chest. Stitching type of pain in chest or violent pain in abdomen while coughing, very important. And then see this cough with enlarged spleen. Okay? You have a patient who has an enlarged spleen and is also coughing. This is very important. Child rubs face with fist during cough. Two more remedies. Causticum pulsatilum. Okay? Very important. See the violent cough which can cause gushing of tears during cough. Patients tell, sir, they might see, typically gushing means it will not fall on you. But you might be seeing them having lacrimation while coughing. Okay? Lacrimation while coughing, involuntary urination, and we saw this. Involuntary stool. Involuntary stool can also happen during sneezing. Okay. Involuntary urination, stool, lacrimation during cough. These are few things you need to remember and the modalities. Early morning, cool drinks, weather change from warm to cold. Good. Warm to cold, morning, evening exertion. These are few things which can aggravate cough in SQUILLA. Cough in SQUILLA. I have a notes. Why do you bother? Just give a note. It's all ready. You can take a pic. But it's a good habit to write. I know when you take it in a soft copy, we don't know where it will go.
and many of you second year you won't have opened till now, and the peak that you would have taken. Anyway, now we spoke of upper respiratory, lower respiratory. Both you need to write in your exams. I'll quickly try to sum up few other symptoms of squilla and heart. A cardiac stimulant affecting the peripheral vessels and coronary arteries. Must be the color is not very clear. Next time I'll change it. A cardiac stimulant affecting the peripheral vessels and coronary arteries. Dropsy, edema with profuse urine. This is what you see. This is the action of squilla on heart. Okay. I have taken this from Dr. Borik's Materia Medica and even Dr. Fatak's Materia Medica. They say action is just like digitalis. Action is just like digitalis. Follows digitalis when it fails to relieve dropsical condition. I'll explain this. You have a patient with heart affections and assume you have given him which remedy? Digitalis. And digitalis has not relieved him of his edema, swelling. There, both of them says, you can think of squilla. And squilla can relieve edema. It can cause profuse urination. Okay? And it can bring out, it's almost like a diuretic now. Many times we have patients taking, what is that medicine, allopathic medicine which increases urination. Huh? Diuretic, what is that? Lasix, diuretics, okay. Anyway. On spleen, painful affection of spleen, aggravation lying on left hand side. Okay. Painful affection of spleen, aggravation lying on left hand side. So though we are focused on respiratory, I have also given you one important indication of heart and of course spleen. And then this is also very important. See, what I wanted to tell you here is shopping girls. What is it? Not shopping girls. Sales girls. Sales girls. Who have to stand for a long time. Okay. So sales girls who will have a tender feet. I'll just repeat. Sales girls, naturally they are standing for a long period. And if they are having painful feet, not any other part, not thighs, not calf. Specifically, if they have painful feet, the only remedy we have in our Materia Medica is squilla. So you have a girl coming to your clinic telling, sir, I got bad pain in my heel. And if you ask her occupation and she says, sir, I am sales girl. Fine. This combination is squilla. Don't miss squilla. Many times we say, oh, you have been standing for a long time. It happens. But why only heel? Or why only feet? Why not any other part? And that is clinically verified in squilla. Okay? So the statement goes like this. Tender feet with shopping girls, feet get sore from standing. See, it can be sales girls or it can be girls who go for shopping. Right? Long time they have been shopping, they have been standing, and then they get a tender feet. You can think of squilla. So a lot of them are doing squilla. They are getting sneezing, they are getting cough, and then we combine sneezing with cough, that will become squilla. Okay, anyway. See another beautiful symptom of squilla. See, icy coldness. I got this image from Google. Icy coldness. Icy coldness of hands and feet. Okay. The rest of the body is warm. We have patients telling, sir, kai kalo. It's like, see, it's as if it is like an ice. So it's so cold. But rest of the body is warm. Squilla. There's another remedy. Maniathus. Rare remedies, pronunciation I should be careful. I don't use so Maniathus, good. Maniathus. The only other remedy mentioned. Maniathus. Okay? hypotensive. These are all symptoms other than the respiratory. And as a final year student, you should be aware. Though we are not going into the detailed explanation, you should be aware. Okay? The last part, is my time up? I don't. Okay, 2 minutes. I can make out from the restlessness, just 2 minutes. Early morning, uncovering motion, cold water exertion, it aggravates. And they are better by rest, sitting up, expectoration, warmth. These are all the general modalities of SQUILLA. Okay? I am giving a note, so don't worry much. Now, this is important. This is just the summing up of my class. And this is what you boys and girls will be getting for 5 marks in your exams. Now, what are the respiratory symptoms of SQUILLA? How do you write it? I'm just giving you a flow chart so that you don't miss things. So you will be focusing on the respiratory, upper respiratory, and 2 things should come to your mind here. Sneezing and coryza. This is just the sum up. Sneezing and coryza, you know the character of sneezing, you know what happens because of the sneezing, and you know the character of coryza, acrid, and then you are focusing on the lower respiratory. Lower respiratory, what are the headings? Cough, cough, what? Yes, what brings on cough? Yes. Character of cough? Violent cough? Yes, exhausting cough. Cough which is of short paroxysm. Tickling in chest, and cough will cause involuntary urination, stool. Or there can be pain in the abdomen, pain in chest, pain in spleen. See, this is how you have to remember. And I personally feel if you understood the class correctly, then I don't think you need to go back, by heart, read. I don't see the necessity of all those things. So please understand the concept very well. Okay. Now the last point will be, as we discussed, clinically, where do we use SQUILLA? So it can be used in rhinitis, bronchitis, bronchopneumonia, spleen affections, kidney affections, allergic rhinitis. Okay. And we also spoke of that. What is it? Feet, tender feet in shopkeepers or shopping girls. Okay. Then dropsy, anasarca, okay, heart affections, kidney and spleen affections. So short remedy. Okay. Any quick questions before we close? All clear? Yes.
So what happens to the phosphorus?
Yeah, we'll discuss that. Okay. So anything else?
Rubrics for
Rubrics, huh? See, rubrics, for example, you can look into the respiratory chapter, okay, and then or cough chapter, and then you have plenty of things. Okay, what rubrics are taken? See, all these things, for example, cough, in that case, so the rubrics are taken in that case, the first case of the boy. 2 small rubrics, one was cough, paroxysmal shock, and face, under face, rubs fist while coughing. Rubs fist, rubs the face with fist while coughing. Okay, rubs the face with fist while coughing. So 2 rubrics if you combine, in the first case the remedy is SQUILLA. In the second case, what single rubric I had taken was cough, paroxysm, shock. Tried few remedies, failed with those remedies, and SQUILLA did wonders. And the girl, came back next day and she told, "Sir, I'm fine." She didn't ask me why you did not give this remedy first. At least, she had the courtesy of coming back and telling I'm better. So 2 small cases.
So what about mind symptoms?
Mind, I thought I had, see, Erigeron, what is this, SQUILLA, these are remedies which are partially proved. Though mind you have, I thought it's a final year class, I did not bother much about mind. You have some symptoms, irritability, malicious. If you do some, utna prominent nahi hai. And what is prominent and clinically verified is
or at least we have not explored the mind part. Proving उतना तक नहीं हुआ है. Okay. That is the biggest disadvantage of small remedies, partially proved remedies. Then, any other questions? Before I take up Chinmay's question. Any other questions? Done? Chalo, thank you. Thanks.